We're talking vaccines. Who better to talk vaccines than these two amazing people? Listen to the title of Dr. Eunice Dirango. I'm having trouble because it's such a long title. She's not only the chair of the Nursing Council of Kenya, she's also Dean, Aga Khan University School of Nursing and Midwifery. Wow. Wifery, right? Wifery. Wow. Tomato. Dr. Khadija, Group CEO, AMREF Health Africa. Good to see you both.
Good to see you.
Dr. Eunice, are you excited about this? Because, there's a lot of people who are not very excited. Are you excited?
Personally, I'm extremely excited. I think when you have a disease or an infection that's really spread so quickly and so fast, and you really don't have a cure, the key solution besides the preventive measures is actually a vaccine. So if there's a way we can prevent the spread of the infection, if there's a way we can prevent the severity of the infection, I'm definitely very, very excited about that.
Yeah. Dr. G, C.S. Mutai Kagwe last night at the airport, he said, this is a game changer. You agree?
It is a game changer, and you keep reminding me. The last time I was here, we talked about the Swiss cheese strategy.
I love it.
Layering interventions.
Yes.
So this is an extra layer of cheese.
After masks, after sanitizing, after
social distancing, then you put vaccines, and then over time, as you vaccinate more people and you have more of the population vaccinated, and then you think you have reached a point of control, then you can drop the other measures. So it's actually one after the other. So I'm excited because it means it's a game changer in the pandemic control.
Yeah.
It is.
Dr. Eunice, nurses have been hard hit by this pandemic. You know this better than I do. What's the feeling on the ground? What are they saying? What are they telling you?
I think the reality is nurses are central to any healthcare system. And what COVID-19 did is to demonstrate that role very, very clearly. So when you think about the vaccine, the fact that they should be among the, the frontline workers to get it, that's a plus in my view. But then you have to realize that they are also vaccinators. So once the vaccine is rolled out, your key vaccinators are actually the nurses. So we have to think about preparing them in terms of acceptance of the vaccine, but also thinking about how do we engage them when we are thinking about the rollout, when we're thinking about the increased workload then that comes with them immunizing or vaccinating themselves as well as other healthcare professionals and anyone else who will be vaccinated thereafter.
Are they ready for it though? Has there been enough education amongst, the nursing community, fraternity?
I think there is need for more engagement. I would like to believe there is also need for training. I know the government has rolled out some training that needs to go out to all health professionals. So we have to ensure that we are using innovative ways like, blended learning, technology, ensuring that trainings and access of materials is, reaches the nurses and reaches them in a timely manner. We also have to realize that at the end of the day, it's the correct, accurate information that the nurses need, so that they can pass it on to the other people who will be immunized. So training is central to this.
Dr. G, forgive my ignorance, but I didn't know we had a cold storage facility in Kiteng. I didn't know that.
You see, Jeff, we have been vaccinating for very many years. I'm 50 now. When I was young, I was vaccinated against TB, BCG. I still have a scar here. So you can imagine that length of vaccination. There are systems that have been developed, and these systems are to ensure that first, when the vaccines arrive from wherever they are coming from, they are properly stored. Vaccines have very strict conditions so that they don't get destroyed or denatured, and many of them will be stored within fridge temperatures, 5 to 8 degrees, some of them even lower. So that means that when you're receiving, as a country, you're receiving many doses because you have many children born every year. I don't know, in Kenya, I think we have 30,000 children born every year. And all those need to be vaccinated until, a certain age. And there are also others born last year. So there's a big cohort of children. So those volumes cannot go directly to the hospitals. They have to be held, and then they are released based on demand. That is the cold storage in Kitengela, which is kind of the country's depot. And then after that, we have depots in the original provincial hospitals in what was called the province. So we have about 8 other depots across the country, to which now these vaccines from Kitengela are sent. And then from there, the counties pull down from there as they use.
And we have the capacity from Kitengela to the former provinces to the other hospitals.
Exactly.
We have the capacity?
We have the capacity. We have the capacity. The Kitengela capacity is excessive. We have a lot of capacity there. When you go to the depots, there is a lot of capacity. Even to hold these 1 million, maybe another million coming, there's capacity. I think the challenge comes into when you get to the facility, because each facility does not have a depot, it has a fridge. Now, that fridge is holding the vaccines for the under 5s, and then you have to now add the vaccines for COVID-19. So that's where now we have to do readiness assessment. Which facility has capacity, which one doesn't, which is what has to be done to ensure that there's enough storage for the ones that have come and are coming.
By the way, could you explain to us this Oxford AstraZeneca or COVAX? What does it mean?
So, okay, let's take a step back. Globally, vaccines are manufactured and supplied to countries. Now, countries that have particular diseases or particular illnesses, because again, they're not equal across the world, receive the vaccines that are necessary to prevent their populations against those diseases. If we look at Africa specifically, and you look at the diseases that are likely to kill children that are preventable through vaccines, you look at measles, you look at TB, you look at tetanus, you look at all these diseases that we actually can prevent using vaccines. Maybe many people remember smallpox from reading in the books because it was eliminated through vaccination in 1978 and disappeared. So these others that are still there have to be prevented. So there's a whole vaccination effort, and because vaccines are naturally free to the public, there has to be a mechanism for financing them. And what was seen is that countries, because vaccines don't really have a demand, they have a need, not a demand. If you have a mother in the village who has a child, they don't go to the hospital knocking, saying, my child needs a vaccine, because they're not sick. It's for prevention. So they then have to be given as a plan by the government to prevent diseases in future. So many governments find it difficult to finance them because there's no real need. It's like, you can get away with it. So because of that need, Gavi, the Global Vaccine Alliance, was created. It was created to raise money and to encourage pharmaceutical companies to manufacture vaccines that are needed, to then negotiate the prices, get good prices, and then give them for free to countries that ordinarily can't afford vaccines. So Gavi has existed for many years. Now, what has happened with COVID is, because the same situation exists, that many countries can't afford the COVID vaccine, Gavi, using the same mechanism it uses for childhood vaccines, got to donor countries, said, give us money, together with WHO, give us money so that we can also get enough COVID-19 vaccines to distribute to countries that can't afford. That was called the COVID Vaccine Facility. COVAX. Just like the normal Gavi work. So just the way we receive BCG, polio, tetanus, is the same way we're going to receive COVID-19 for free into the country. So the first million we received yesterday was from this Gavi facility, supported by WHO and donor countries, for us to vaccinate our people for free.
Dr. Yunus, I have quite a few friends who have told me to my face, I'm not going to take this vaccine. I refuse. Why is that? Why aren't we as excited as we should be?
I think for every new disease, COVID being one of them, it's a new disease. Everyone was trying to understand the infection. Everyone was, creating stories around that infection. Then now you have a new vaccine. And of course, people are concerned, is it safe? If I take it, what are the long-term effects? So the first key point, of course, is ensuring that anyone who's concerned, the general public, all healthcare workers, have access to accurate information about the vaccine, how it works, but also a sense of honesty on what are the side effects, if there are any. Because then if people know what to expect in terms of the side effects, then you have better acceptability and understanding of what happens to an individual thereafter. So for me, it's about making sure that that information is appropriately communicated, but also is being aware that social media is very hyperactive. So what do we do then as a country? What do we do then as a population to ensure that we are drowning that space with what is accurate and what is honest about the vaccine and how it works? The other element towards this is there's so much information flowing. So how do we ensure then that an individual is able to sieve what is accurate and what is not accurate? And in a situation where there's a lot of anxiety, a lot of fear, you can guess where people tend to lean towards. So yes, we need to ensure that people are convinced that this vaccine is the way to go. Going back to what Dr. Ari said, it's yet another layer of prevention that we need to put in place.
The other concern is pregnant women, and I'm sure you've heard this. Should they not be? What are you advising?
I'll say what I think I know, and then Dr. Ari here can add.
Okay.
For every vaccine, there are contraindications of who can and who cannot get them, which means there are those who are said can get a vaccine and there are those who are said they cannot get a vaccine. Now, the tricky part with pregnant women, just like it is with young children, is that experiments or clinical trial where drugs are concerned is usually a very difficult environment to work in. So you will not find a lot of evidence or a lot of trials that have been done to show efficacy and safety of a drug because of the challenges that exist. In the case of a pregnant women, you have the mother and you also have the unborn child. However, there have been situations that are recommending that when a pregnant woman is at a high risk, for instance, if you're working in a setting where you're likely to be infected or at risk of being infected by COVID, then the risk of getting the vaccine outweighs, isn't it? The risk that you would face if you were to get COVID. Dr. You may have something to add on to this.
Yeah, the issue here is about research, as she's saying. It's about evidence. It's not about evidence that shows it's bad. It's about lack of evidence that shows, it's good, or the effect of that. And it's because of all the reasons she's saying. So when you're developing a vaccine, then you take it through research, and at some point you test it on animals because, there are certain ethical standards you need to show before you take something to human beings, for obvious reasons. So when you test it on animals, there may be studies of pregnant animals as well to see, does this vaccine affect the fetus inside the animal and all that study. But then you need to then extend those studies to say, okay, now we've also tested on pregnant women. Now what we know of the vaccines available is that studies have been done in animals, in pregnant animals. There has been no evidence that the fetus inside the animal has been affected in any way, but there has been no extension because of the process of development in pregnant women themselves. So what the recommendations are from WHO and from all the manufacturers is that when you're giving to pregnant women, give with caution and say, but there is no disclaimer that do not give it to pregnant women. So then the measure then is what is the risk for these pregnant women, but that's what is the benefit of receiving the vaccine. So if you're working, as she says, in a very high risk environment, then it is recommended you should be given the vaccine and you should receive it because there's no evidence it will harm you. There's only that there is no evidence that it will not.
It won't harm you.
Exactly. Risk versus
six of one, half a dozen of the other. We don't know for sure.
Yes, we don't know, but the available animal studies show that there is no harm that has been noticed yet.
By the way, you guys
are margin of safety.
You guys are first in line, basically, right? Frontline
health workers.
Yes.
Right.
Yes.
Who else?
So initially, it says frontline health workers. I'll actually probably give my position to a frontline health worker because I'm not actively in the front line, but frontline health workers like Daktari here, and then we have teachers because of the situation they are in, security forces because of the situation they are in, and that kind of forms the first cohort. And then after that, you move to people with other diseases whose risk is not about necessarily infection, but the risk that they may be low risk of infection, but they're very high risk of severe disease. Those are people with hypertension, diabetes, the elderly. So that will be the next cohort. And then after you finish that, you move to individuals who live in what you may call congregate situations, prisons, refugees, people who can't social distance. So it's a risk scale, basically.
And how long is it going to take to distribute 1 million vaccines, 1 million plus? How long is it going to take?
I think the first phase of vaccinating 1.2 million people, which was the first priority list, was estimated to take about 3 months. So March, April, May. So maybe end by June. That's what was estimated. But in the reality, it could be faster or slower because, the proof of the pudding is in the eating. You might say you go, then maybe there is challenges with health workers. They need to be retrained. At some point there were industrial strikes, so are the people there or not? So there are all these other factors that will play in the live environment. But the estimate was about 3 months. Yeah.
Dr. Nunes, you have colleagues in places far and wide, from Mandera to Warji, you name it. Are they concerned?
They are concerned. I mean, the reality of our practice setting is that things are complicated, We have to think about how do we get the vaccines to Mandera, for instance. We have to think about how does a nurse in Mandera access the training that we're talking about. We have to think about cold chain maintenance from source all the way to when that vaccine has to be administered. So the concerns are there. And for me, I look at the concerns as an opportunity for us to look at how then we get people on board. How do we get people engaged? Because that has been the main message. Nurses haven't been engaged. And Dr. Ari knows this because it's something we talk about a lot. If you look even at the task force, the first question I would always ask myself is how many nurses have been engaged? So we need to engage nurses from the onset because they will operationalize these things. So they've got to be at the table when, discussions are being had, when challenges are being mapped out, when solutions are being mapped out, because they live that reality. The other ones will carry that flag for this COVID vaccine in this country. So yes, I would say they are concerned, but there are ways of dealing with those concerns.
Yeah, the other concern, well, Dr. Ari, let me ask you this. In the West, you see leaders going out of their way to get vaccinated just to give confidence, appease the rest of the population. Do you see that happening here? Should the president lead the way?
Well, if you ask me my personal opinion, the president should lead the way, and then after that we should go to the priority list. And it should be just a signal of confidence. Vaccinate the president, and then after that move to health workers and to the people who are actually desire to be in the front of that list. But it's a choice, a personal choice. So that would be my desire, but it's personal choice because, again, vaccines are not mandatory. They're not mandatory. So, but that would be my desire, that we see the president being the index vaccinee. Yes.
Dr. Yunus, the other concern, side effects. Nobody really knows, huh?
Every vaccine, every immunization, even the ones we give to our children, the childhood immunizations, they all have side effects. So side effects are part and parcel of anything we take in, even Panadol. It's just that we accept some more than we do others. So the side effects are known of the COVID vaccines. And for me, the issue is ensuring that we make it very clear what that side effects are. And in the bigger structure, the task force that Dr. Ari sits in, there are measures of monitoring that information. So what we need to make sure is that when we communicate about the COVID vaccine, we communicate articulately what side effects we expect. We train our healthcare workers who are going to give the vaccines to be able to communicate that information. But we need to collect that information and collate it together. I mean, we've seen even in the pandemic, there are differences in terms of how different populations are responding to the pandemic. So we will have our own differences. So those need to be collected, documented, and communicated centrally so that then we are able to keep an eye on, what is happening and what is acceptable and what is not. And for any other adverse effects, as we call them, there have to be measures in place to deal with them. And the person who's at the hospital and the facility giving the vaccine needs to know, if I see this in a patient, where do I refer this patient? So that system needs to be in place because we don't know what may or may not happen, but we have to be prepared for any eventuality.
You must be hearing all kinds of horror stories from people all over the place. You must be hearing them. How do you reassure them? How do you say, you know what, you're not going to grow an extra eye, or you're not going to...
So the thing is, for every, I don't want to say horror story, but for every misinformation or myth that you see in social media and so on, it is amplified 1,001 times more than the accurate information. So I would say, if someone gets vaccinated, we need to tell that story as real as it is. Eunice, I'm here, I've been vaccinated. Did I get side effects? Maybe I had, a rash or whatever, and I'm fine. Several weeks down the line, I have had my second dose, and I'm okay. So we need to tell the true stories and tell them as loudly as we should, more than we could talk about all the other stories and the myths that are there around the COVID vaccine.
Yeah, Dr. G, with social media in this day and age, you can't help but believe those myths or, second guess this vaccine or that vaccine. You can't help but do that.
Yeah, exactly. And fear is what drives these things, and anxiety, and the need to know, like as she says, we haven't seen people repeating over and over on social media that, these vaccines are 95% effective. That's a forgotten fact. But the moment something comes up, then everyone pushes. Let me tell you that the number of questions I've had that are related to, there's something we used to say, too much information sometimes is dangerous. So I have, somebody asking me, I hear this vaccine was tested on chimpanzees, but no one ever asked where was measles tested. Because that information was never given. No one ever asked where was BCG tested. But because this information now there is an eye on COVID, these issues that are regular issues, for drugs, for vaccines, for other commodities, are now being amplified for COVID-19 because it's a pandemic. So we just need to know that those issues, there's nothing unique in the COVID vaccines that we do not have in other vaccines, that we do not have in other commodities. It's just that there is too much of a lens, a focus on the COVID vaccine, but nothing unusual that we've seen here that we haven't seen in all the other drugs and commodities. Nothing at all.
Dr. Yunus, let's say you get your jab on Monday, right? The next one is due in 2 months' time, 6-8 weeks. What do you do in between? What does one do, for instance? Must be a lot of people are wondering.
You wait, you live your life as you should, but you continue with the measures that are in place. You have to continue to social distance or physical distance. You have to wear your mask. You have to hand wash. So you live your life as you should. I would say so, and I would say wait for the second one and look forward to it.
Yeah. That's really basic information, but it's so true.
Yes.
And this is a word I've always wanted to use in my life. This thing is not a panacea, right? I love that word, panacea.
Yes.
It's not the cure-all.
No.
People should know this.
Yeah. People should know this. But let me raise this issue that we actually take our children for vaccination so many times. Every mother who has a child, take the child for vaccination every 4 weeks, every this, and you take them back. And during that vaccination, when the mother, before you deliver, you are given tetanus shots, it is exactly the same. There's actually no difference. So now, because this is an adult vaccine, we are so scrutinizing it, what's going on. But I would understand because it's new, so there's anxiety. But I just want to reflect that we take our children for vaccination every so often, and we do so comfortably without worry because we are reassured vaccines are safe for them. Let me just say that over 240 million people have received the vaccines across the world already. We haven't had a crisis of side effects or people dropping or anything. That's a huge number to actually back up on, that over 240 million have received different vaccines across the world, led by China, America, UK, UAE, Israel. Morocco has vaccinated almost 3 million. So we should have the confidence that actually the vaccines are already in use, they have been tested, they have been approved, and these concerns about the side effects should be explained, as she says, through correct information.
By the way, Johnson & Johnson, as you both know, they got theirs approved the other day,
yes,
which is a one jab. It's a one shot.
Yes.
How different is that from, obviously this is a 2-shot, but explain.
So the issue on the doses and the shots has to do with the level of effectiveness or efficiency or effectiveness. Let's call it effectiveness, efficacy. So what happens is, if you get any of the doses of AstraZeneca, Moderna, the ones that are 2 shots, the first dose gives you maybe up to 50% protection. Okay? So you need a second dose to boost that to 90%. So it's not that the first dose doesn't give you any protection, just that it is lower and maybe short term. You need a booster. Okay? Now, for the Johnson & Johnson, the way they have prepared it, the first dose may give you up to 70%, which means you don't need a booster. So it's just about boosters to ensure you have the right level of protection. There's nothing else. Yes.
A lot of nurses have already gotten COVID. What happens now when they get this vaccination? Can one get it, or does one have to be in a certain window when you're getting the vaccination that you haven't had COVID for 3 months or 1 month or 2? Do we know? Does anybody know?
Yeah, we know that there is no recommendation to test people for COVID before you give them the vaccine.
Oh.
None.
You just vaccinate.
As long as you don't have symptoms, you don't have a high fever, you receive the vaccine. You're candidate for the vaccine. And there is no contraindication as such to saying because you had it, therefore you can't receive it. Now, what happens is, if you know that you had it and you had a positive PCR test, you can delay. You can delay the recommendations. You can delay up to 6 months before you get your shot. But that doesn't mean because you know you had it, therefore you don't get a shot. No. Because no one knows how long natural immunity takes. and you're one of those people, isn't
I
it?
am.
Yeah.
What do I do?
You'll get a shot.
You're eligible to get a shot. So you will get
But
a
I
shot.
am not a priority.
If you consent, yes, when
I'm
your time
down
comes.
the line.
Yes.
I'm nobody. I'm phase 3. By the way, can one get tested positive after getting this vaccine? Do we know? We don't know. Can one test positive after?
We don't know. You know, the thing is, if you get infected, you'll get, because the
Symptoms.
vaccine, and you know, I'm sure Dr. Agri is not supposed to stop infection. It's supposed to stop severity. So you can still get viruses, just that you'll not develop severe disease because your body already has been primed to fight that particular virus. That's the role of vaccines. The role of vaccines is to imitate the disease so that your body then develops enough soldiers and packs up itself with guns and ammunition that if that enemy ever comes, the body has already learned. That's it. It's like a military drill. It's your body being given a military drill. The other way we do military drills before terrorist attack. You're given a military drill so that if that ever comes to you, then you are ready to fight it before you develop severe disease. So you can still test positive. Yeah.
Wow. Interesting times. Let's take a break, come back, talk some more. I know folks have a lot of questions for you guys. Get ready.
I see chicken and eggs.
What came first, the chicken or the egg? Well, commercial break comes first. Keep tweeting at Koinange Jeff at Citizen TV. Can you the hashtag? It's JKLIVE. JKLIVE takes a break. We'll be back in a moment.